You're listening to Astonishing Healthcare, the podcast hosted by Capital RX, focusing on the biggest issues affecting healthcare consumers, benefits plan sponsors, and health plans. We're covering the inside baseball on how things truly work, or don't, in the U.S. healthcare system and pharmaceutical supply chain in an astonishingly efficient way.
Hello, and thank you for joining us for this episode of the Astonishing Healthcare Podcast. I'm Justin Veneri, Director of Communications at Capital RX, and your host. And this is part 2 of our discussion with Jillian Lonson, Senior Director of Benefit Administration Operations, and Jean Beman, Manager of Benefit Operations and Administration here at Capital RX, on what really is pharmacy benefit management and what goes on behind the scenes. Jean and Jillian, I've got some more questions for you, so thanks for coming back.
Happy to be here. Hi.
So last episode, we spoke high level about what a PBM is and the core things that you two set up and your team helps set up for our clients to enable their members to pick up a prescription at the pharmacy. So I'll link that show along with some other resources in the show notes. And I think we can get right into some of the more detailed topics. Starting with you, Jean, can we tackle a fear that we hear a lot in the field, or that our team hears a lot from prospects and folks in the industry, some common challenges employers, for example, face or need to solve for when implementing a PBM solution, especially relating to the configuration? Who do you work with to configure things, operationalize the benefit, et cetera, to ensure that things go smoothly?
Yeah, great question. So the number one thing I think that is a very large fear with employers and moving in from a legacy PBM to a newer PBM is consolidation is one of the key components to make Judy different from typical big box PBMs who are not capable of consolidating their account hierarchy. What I mean by consolidating is that they have a much larger benefit build in their previous incumbent PBM's system that makes it so that it is very inefficient. So what our goal is to reduce all of those duplications to essentially enhance the efficiency of overall the build of the book of the benefits for the client, but also later down the line, the plan maintenance is much less cumbersome.
Got it. Jillian, anything you'd add?
Yeah, so I think Jean really hit the nail on the head. One of the key differentiators with Judy is that, to Jean's point, we can take a client's benefits from a legacy platform where they may require, for example, 250 plans be built. Given the limitations, we can consolidate those 250 plans into maybe 100 or less plans in Judy, really depending on the configurations we take a look at. That means less plans for the client and us to manage and maintain, which ultimately creates downstream efficiencies throughout the life of the plan. We have found that clients are pleasantly surprised by Judy's ability to consolidate at a very granular level while still maintaining the same level of benefit designs. When it comes to who we work with during the process, it can vary. Typically, my team will work with the client and their consultant if applicable, and any vendors we need to account for during the configuration process, such as accumulation vendors, medical vendors, etc. Benefits works with all areas across Capital RX to facilitate and execute on our side, which, based on my career experience, is something that sets us apart from other organizations. We operate holistically and are not siloed in any sense of the word. Every area is aware and informed along the way, which ultimately contributes to a seamless execution, which is really always our goal.
Okay. And how crucial is thorough testing during the implementation process? What are some best practices for ensuring a smooth testing phase? Jillian, you want to take that?
Yeah, that's a great question. So testing validation is just as important, if not more so, than the actual configuration step. This is where my team ensures that what we built in Judy meets the client's intent. Our primary goal when testing is to mirror as many scenarios as possible at the pharmacy, including anything that may be custom as well, so that there's no member impact when a patient fills their medication at the pharmacy. As a standard, my team tests over 700 unique scenarios for each plan design to ensure everything from the cost shares, the accumulations, plan maxes, clinical rules, formulary, and network. Obviously, that's just naming a few. There are many other pieces that go into the configuration, but our ultimate goal is to make sure that everything is set up accurately well in advance of the plan start date. And then once all of the configuration is complete and peer reviewed, we run our batch testing scenarios against the benefit. And once those are run, my team will then perform a validation check to ensure the actual scenarios that we enter into our batch align to the anticipated scenarios again in the batch. And then the testing goes through 3 additional layers of review via the account management and implementation teams to ensure alignment prior to closure of the plan.
So you really, at any scenario, and by scenario, you mean any patient pretend walking into the pharmacy.
Exactly. Yeah. So we try to mirror, obviously, there's going to be endless amount of scenarios at the pharmacy, but we really try to account for every common scenario and those custom scenarios that we might come across in a day at the pharmacy. And we just want to make sure that when that member walks out of the pharmacy, they paid the correct cost share, they got the medication they needed, the correct quantity within their plan limits. If they had a deductible, they paid the part of their deductible. And, I didn't talk too much about the integration piece, but a lot of plans are commingled with medical benefits. So that's also something that we make sure that we set up on the plan so that the correct pharmacy dollars apply to the medical buckets, if applicable, and then vice versa. So, we need to make sure we're integrated with the medical vendor so that when they send the medical dollars over, we accumulate those to the correct pharmacy buckets as well. So there's a lot that goes into it.
Gene, anything you'd add?
Yeah, I just would say that with testing, it really is the last stop out the door before a plan goes live to make sure everything is truly tied down and working. One thing that we regularly do is small scale test our templates to ensure that they're up to date and according to the formulary, clinical, and any other program updates that we may have throughout the year so that we are up to date and ready to go and ready to run when we have a new implementation.
Okay. And Gene, I'll stick with you. Can you share a real world example of effective configuration leading to significant efficiencies in PBM implementation or go live?
Sure. Just moving from an older adjudication platform to Judy, it's clear that Judy was designed with a lot more operational efficiencies in mind. I used to spend hours manually building, then waiting hours and hours for batch testing to even load to run. And with Judy, we can not only bulk load entire benefits, but we can build manually, and it takes literally minutes. And our testing is returned for review from Judy from a full build, looking at roughly about 700 different scenarios in a matter of 15 minutes or less. So this to me is a huge effective efficiency overall, just because of the thought in mind that was put into the adjudication system.
Yeah, and I think Jean really said it best there. Judy was built with operational efficiencies in the forefront. We know what works and what does not work given our industry experience, and we always make sure to not reinvent the wheel on things we know that work well and create efficiencies around those processes where there may be areas for opportunity. And I think this really contributes to making the process smoother, seamless, and successful.
And what are some key considerations that payers, plan sponsors, plan administrators, other stakeholders responsible for their benefit program, what should these folks keep in mind or prepare for when configuring a pharmacy benefit to ensure that it aligns with their specific needs or goals, DEI or otherwise? Jillian, want to go first?
Sure. I think my biggest piece of advice is don't make it so complex that it becomes frustrating and challenging for members to understand their own benefits. We understand that there are unique scenarios such as state requirements or regulatory requirements, and even decisions that are made to optimize plan spend. But where standards can be elected, to really try to mitigate and minimize member confusion is always my recommendation. Throughout my experience, I've seen too many times where payers want a specific configuration even after a consultation with our internal teams, and they decide to proceed with it. And then a week or two goes by once the plan goes live, and then we receive a request to terminate it due to member noise. So I would just say, where there's standardization, we always love to make that recommendation. Obviously, Judy is an amazing platform. It can support pretty much anything. And if it can't, we can build it to support it. But at the end of the day, if it's confusing for me, configuring your benefits, then more than likely it's going to be confusing for your membership to understand their actual benefits. And It's a very sensitive scenario when you're going to the pharmacy and you need something quickly and you thought your cost share was this and it's actually not. And by the way, you can't even get it there anymore. So, really, just having the member as a top priority is always my recommendation, and simple is best.
I would agree with that. I think really ensuring that you're reducing the amount of member noise that you can on your plan, therefore reducing the complexity, is a really big deal. And really being aware that setting limits on certain drug categories could inherently create roadblocks for individuals who need access, and to be mindful of the options available by looking at the overall population requirements.
That makes sense. So, by keeping it simple or straightforward with the member in mind, you're basically saying, Gene, like your example of limits on certain drug categories, whether it's utilization management or something else, basically make it as easy as possible for a member that has a prescription from their doctor to actually get that medication when they're in the pharmacy with relative ease.
Exactly.
And so, how do you collaborate with clients and balance the need for customization? Because I imagine they have all these scenarios in their mind of, hey, we'd like to do this or that to control access or provide a richer benefit in some cases. What are sort of the average times needed to properly configure a benefit for a client?
My team benefits, we always take a consultative approach when we are collaborating with our clients to really just ensure that the benefits are built most efficiently for everyone. Our goal is to always meet client intent, but we are not shy when it comes to more optimized approaches. Our clients are very open to exploring alternative solutions as we build that trust. Average turnaround times can vary based on the configurations required, but what I can say is that they are much, much smaller timeframes than traditional PBMs, having been in the industry for, I don't want to age myself, but 20 plus years.
Not to plug Judy, but I would have to assume that a big portion of the configuration turnaround time is attributable to what system you're working in to configure something. Is that fair?
1,000%. And our product and dev team really keeps up with the changing times. So as the industry evolves, Judy evolves before it. So the system that we use is very efficient. I love Judy. It's amazing. And that really does contribute to our reduction in turnaround times when compared to your traditional PBMs with legacy systems.
Okay. And how important is ongoing optimization and fine tuning of the PBM platform post implementation? And what advice or suggestions do you have for payers to continually improve efficiency or scale with the business if that's necessary?
Yeah, I think Judy does a really great job of accommodating 95% of clients' needs. And there will always be those edge case scenarios that we come across. So, we partner very closely with our product and dev teams to build new logic as necessary. I think, regardless if we have recommendations for efficiency gains, we discuss those needs with this team, who are very open to wanting to make Judy the best it can possibly be, as well as making our processes more efficient at the end of the day. Enhancement requests, I don't want to tout, but they take weeks, not months or even years. I've worked at other organizations where they wouldn't even look at my enhancement request for 6 to 8 months. That really contributes to our overall success as an organization as well.
What would an enhancement request look like versus a configuration request? I know when I spoke to Jason Barretto a while back about just government programs and meeting intent, I think there's commonalities, and I think like sometimes plain examples are helpful. Can you kind of break down the difference there for us between what an enhancement might be, which would take a lot longer in a legacy system versus shorter in Judy, or what like a configuration might be?
Oh, Jean, you want to take that one?
Sure. A really easy example, and looking at current function of everything that's going on with Medicare going into next year, something like adding M3P functionality in a legacy system would probably take minimum of months of just development, just in the back end to get it complete. With our adjudication system and our development team, we were able to get M3P into our system before CMS had even fully finalized all of their documentation, so that we were ready to go and ready to be flexible where needed based off the final rules that were put down.
And that falls in the enhancement bucket.
Definitely. Yes,
Okay.
definitely an enhancement because it's not something that previously existed in any adjudication platform.
And then so like a configuration of a benefit would be
Configuration of a benefit then would just be actually implementing what a client had specifically elected and what's
okay.
already there in our UI system. So what you can see and physically elect for based off their benefit. As far as advice goes, really ensuring that your development team and operations team are on the same page with scalability and prioritization of product development is truly key. To Jillian's point, our development team is very quick to respond and quick to prioritize different product items as we are enhancing and evolving continuously. And one of the most important key things that I think that taking it back that we really do best is really ensuring that we are not siloed and that everybody is on the same page. And that is something that is very different and very unique about Capital RX.
And last question. I'll start with you, Jillian. What's the most astonishing thing that you've seen or experienced that you can share, of course, relating to benefit configuration, implementation, or something else relatable?
Yeah, so this might seem simple, but honestly, it was the user interface of Judy. Coming from multiple years on a legacy platform where each day was a challenge to perform even the simplest of tasks, it was really quite daunting to me. I feel like this industry moves at such a fast pace that systems should be able to quickly adapt at the rate of those changes. And it's funny to say, but I didn't know what I was missing until I logged into Judy for the first time. I was completely astonished at how user-friendly the interface was and how simple it was to perform even the most complex tasks. I always say that if I told my daughter, who's 12 by the way, to build a benefit with our workflow, that she would be able to execute with minimal oversight. It doesn't have to be complicated, but a system should be able to support those complicated things with ease. And that is exactly what Judy does. It really is a one-stop shop, and our product and development team is absolutely amazing at keeping up with the rapid pace of this industry, which truly is a differentiator in the market.
Thank you. And Jean, I know in the last episode you mentioned bulk loading benefits. I'm curious, what's the craziest thing you can share that someone's asked us for during, an implementation or that you've seen previously or heard of?
Something not configuration necessarily related, but testing related. A couple years ago, we were running end-to-end testing for a client during implementation. And with end-to-end testing, it is extremely high volume in claims. So we're looking at roughly anywhere between 100 to 200,000 claims, which is quite a bit. In my past life, if you were to try to run end-to-end testing like that, you would literally just break the adjudication system. And you would probably break it for pharmacies at point of sale because it would be an overload on the system. With our capabilities, we have the ability to submit our testing so that it doesn't actually hit our true production environment. It's truly actually testing just from a test aspect. So we have the capability not only to process those and our adjudication system does not break, but we also likewise were able to process those, I believe, within less than a day, which was awesome to see that it had actually successfully processed.
That is pretty cool. So thank you for geeking out with me a little bit today on all of the things that you do in the background to really help get our clients' plans set up and configured appropriately and so that they can go live and members have a smooth experience.
Thank you. Happy to be here.
Thank you for having us, Justin.
Thank you for listening to Astonishing Healthcare by Capital RX. Head over to cap-rx.com/insights and visit the podcast section for show notes and other relevant content. If you liked this episode, be sure to subscribe so you don't miss the next one. And definitely share the link to the show with your network if you enjoyed it. Have a great rest of your day.